Hello and welcome to Health Digest, a program that brings you news, analysis and development on everything that concerns your well-being. I'm Ogom Ezedimbo. And today we are talking maternal and child health with our focus on stillbirth. And stillbirth is one of the most devastating outcomes of maternal and child health, yet it remains largely underreported and poorly addressed in Nigeria. Zamfara State is reported to have the highest stillbirth rates in the country. And today on Health Digest, we delve into this silent crisis to understand drivers of stillbirth in Nigeria and what can be done to stop the preventable loss of babies before they take their first breath. My guest is Margaret Kodishola. She's a health expert and also the former Speed Project coordinator. Thank you so much for being a part of the program.
Thank you for having me.
So let's begin with understanding what stillbirth is all about.
Okay, stillbirth in Nigeria is a tragic health concern now because we have one of the highest stillbirth rates in the country globally, alongside China, Republic of Congo, and all the rest. And it's a silent tragedy, like you said, that occurs within the communities that need to be addressed as individuals, because it's not just as implication on the families that are being affected, being traumatized, but also has an health economic implication on the country and even on the states as well.
So is it different from a miscarriage, neonatal death?
Yes, stillbirth is totally different. Like stillbirth is the death of a baby before, within 28 weeks of gestation. So the baby is born, but no sign of breathing. But miscarriage happens before 20 weeks.
Okay.
So that's the
so
difference.
but most women don't. Is there no possibility of having a miscarriage at 28 weeks?
There's possibility. Yes, there's a possibility, especially if the problem was not detected early for medical intervention to be taken care of, and then if probably the woman has not been attending poor antenatal care prior to the situation. Okay.
Now, within a 10-year period, the Speed Project identified Zamfara State to have the highest stillbirth rates in Nigeria. What could be the driver of this trend?
Okay, like in the northern part of the country, they are experiencing insurgencies, yes. Okay. So the main driver could be insurgencies, insecurity that prevents these women from going from their homes to the primary health care because of fear of being kidnapped or the fear of being arrested. Then another driving force is the cultural, traditional preference for traditional birth attendants than healthcare workers. Then a major driving force could be the poverty economic situation within the country. Most of these women sometimes usually complain of the high rate of accessing healthcare in the healthcare services in the healthcare facilities. So sometimes they prefer using a cheaper option, which is the cultural traditional birth attendants, which could open them to more risk of miscarriage or stillbirth.
So you mean poor health-seeking behavior is a contributor? Is it just for Zamfara State or in general?
Majorly because our findings found out that the majority of this high stillbirth rate occurs in the northern part of it's majorly for the Zamfara State. We have cultural, it's a multi-sectoral problem. We have cultural aspect. We have if the woman is not eating, economic aspect, if she's not doing the right, eating well. Then we have, of course, limited healthcare facilities. Some facilities have limited health professionals that could help these women receive the timely care they need. So most times, again, because most of this happened in remote areas where healthcare access is a little bit far from them, transportation cost for them sometimes to go to this healthcare facility, sometimes go to on bad road. In the process of carrying a pregnant woman through this, she may probably have a miscarriage or stillbirth before she gets to the facility.
So antenatal care plays a very big role.
Yes, it does.
In all of this. What is access like for antenatal care in Nigeria generally?
To be honest, the Nigerian government is doing a lot to ensure that they are, every pregnant woman have access to antenatal care services. They are doing a lot in promoting access to care, ensuring that people know these care services are available and are able to access it. But because of some other challenges that we have that we cannot, it's beyond our control, like the insurgencies, the financial constraints, and the economic situation, sometimes literally limits this access to care. So for a pregnant woman, she needs antenatal care right from the time she notices she's pregnant, and to monitor her throughout the process of pregnancy and even after delivery, so that she can have, both she and her baby can be healthy.
Now, the study that was carried out recommended real-time monitoring and data integration into the Ministry of Health dashboard. How can data transparency help address this issue of stillbirth in Nigeria? Okay,
data transparency helps address this issue because the data is out there. Data speaks for itself. It shows why, where, and how, where this stillbirth is occurring, how this stillbirth is occurring. It shows the trend, it shows the patterns, and this trend and pattern can be, shows insights that can be pulled and used for programmatic planning and decision making, especially in financing, budgeting and financing. If a data shows that there's a high incidence in a state, more finance programmatic planning will be pulled to those states to give them strategic intervention to reduce the stillbirth rate. So data speaks for itself, and it plays a key role in decision making and planning.
Okay, looking at our healthcare workers, do you think they are better supported to be able to recognize and respond to stillbirth issues in Nigeria? Are they better supported?
If you look, I would say yes, no. If you look at the aspect, yes, in the aspect that Nigerian government is trying a lot. There are so many remote areas whereby when you get there, you will see a primary health care and at least one or two, community health workers or two working in that area. They try as much as possible to equip the facility. But no, in the sense that our population is high. So the number of healthcare workers to the population size is not enough to address some of the health challenges we face in the country. So that's why government is prioritizing young ones going to school to study medicine and coming out to do better. So that's my thoughts on this.
Finally, what I want to ask you is what can expectant mothers and families do to prevent or protect their mothers from having stillbirth children?
First of all, as a mother, she should prioritize her health first, which is the important thing. The moment a woman discovers that she's pregnant, she needs to register, enroll for an antenatal care, and follow up regularly. Second of all, the woman needs rest, and of course, nutrients that would keep her and her baby healthy, reduce strenuous activities, and also as regards to our family members, they need to support her in various aspects of ensuring that she has the proper rest and nutritional needs that she needs. Then the government too should, in some places, especially in the remote places, should provide free access to antenatal care services for these remote poor, vulnerable villagers so that they can easily access care. And also the government should ensure that we have facilities and healthcare workers that can handle these facilities, especially during emergencies. Then we as individuals, as community levels, at the CSOs, at faith-based organizations, we play a key role in ensuring that we use our voice as an advocacy tool to keep promoting safe healthcare for pregnant women.
So, but we know that the SPEED project has ended. Anything after that beyond the program?
Yes, even though the program has ended, the program has some sustainable plans, which is number one, which was the inauguration of the constitution of the SPEED project Data for Use Advocacy Core Group and the Media Against Stillbirth Core Group. So this group is still in existence, and the teams in this group have been built. We build their capacity in communicating evidence-based messages out there and also implementing that interventions within their local CSOs and organizations and all the rest. Aside that, on the Federal Ministry of Health website, we have a Stillbirth dashboard that is currently running that has the findings from our project, from DHI, our data analysis pool from DHIS2 from 2014 to 2023. That's 10 years interval that policy makers and change makers, influencers can go there and extract data for use. And this dashboard would periodically be updated by the Ministry of Health and Social Welfare.
Are these data useful? What I mean useful, do they make our government, do they make use of this data?
Yes, right there.
Are you sure by the time we come back for another 10-year window, we'll not find the same statistics?
No, right there. Before we finish the project, we had the Senate Chairman, Senate Committee on Health commit to. She was very, that's Senator Balingo, she was very committed to the use of the data in the legislative sector and our findings. Of course, we had a high stakeholder meeting with the coordinating Minister of Health, Professor Ali Pate, and right there we had 3 of our proposals being implemented. The Stillbirth data is now an indicator that it focuses on quarterly and ensures that his eyes is told us, just as he said, my eyes are on the data. So he monitors that and the program. And then, of course, for the Zamfara State, he personally told us that they were going to take an intervention to that area. So definitely, the Ministry of Health, I'm not covering for them, but they are doing a lot in that aspect, and it's helping the community, though we still have a long way to go. But just as we predicted, if we continue this intensive interventions across various states, Nigeria could get the reduced stillbirth rate at to year 2027, just like the world targets. Okay,
so before I let you go, I'll need you to talk to especially expectant mothers, you know, what they should do, how to take care of themselves so they don't have stillbirth babies.
Okay, first of all, their health is their priority. Once an expectant mother knows that she's carrying a live baby in her, so it's a priority to ensure the safety of this live baby, and first of all is to rest adequately, eat well, ensure she register for antenatal care and follow up with routine monitoring check, because this routine monitoring check will be able to identify areas of if complication arise, and intervention will be done quickly to save the mother and the child. At the same time, also she also needs family support. The family should also support her in every way possible. The community members, the stakeholders, CSOs, ensure that good roads are made. Government organizations should ensure that budgeting are used for assigned projects and interventions within primary health care that would improve antenatal care for mothers and babies. So as a woman, our first priority is her and her health and the baby. So that's the main priority. She should ensure at every point in time, feeding, going for a checkup, resting, reducing strenuous exercises, and just being happy. You know, when you are happy, your mood is happy, your weight is happy, and then ensure that everything goes smoothly throughout the phase of our period.
Thank you so much. I have been talking with Margaret Koju-Sola. She's a health expert and also the former Speed Project Coordinator. And we've been talking about stillbirth and how we can ensure that mothers give birth to a healthy baby instead of them leaving us before they take their first breath.
On Health News Today, the Presidential Initiative on Unlocking the Healthcare Value Chain and Kano Research Center have signed a 3-year strategic agreement to collaborate on clinical trials and research. The partnership aims to enhance Nigeria's healthcare system through research and development. PVA's National Coordinator, Dr. Abdul Mukhtar, emphasized the importance of research in delivering quality healthcare.
Beyond the research component, the ideas extend beyond to the other parts of our mandate. You showed us a water treatment plant where you are trying to convert into an IV fluid facility, which we strongly recommend and support. And this is a great idea. It looks at great minds. You know, you are not thinking within the box. that everybody will say, yeah, a research center, but they're translating that research into other capabilities. So I think you have everything that it takes for you to succeed. And we are here today. One of the things we're doing today is to sign in a memorandum of understanding that will be the guide for forging a partnership between our two institutions. And you can always count on us. You can count on the Minister of Health. You can count on the President, President Bola Ahmed Tinubu, to do whatever, because this is a national asset, as far as I know. So we need to do whatever we need to do to support it, to upgrade it, to elevate it, to advocate for it.
According to the leadership of the center, they have a standard infrastructure and hopes that PVAC will help showcase the potential of the center to the rest of Nigeria in terms of research, and also help link the facility with the right investors for possible IV fluid production.
I'm happy you've seen some of the things that we have. The lab especially, I think that is where we can contribute a lot to the state and Nigeria. For instance, with AMR we've talked about, we have one of the finest equipment in AMR technology, AMR research, and this year, as the Board of Trustees, they've accepted, Pfizer has accepted, we're going to further strengthen the labs, especially the AMR as well as the genomics.
We're happy with your comment because it will assist us in showcasing the great potential this place has. And this potential is waiting to be harnessed. And we at the board and the management will sit down and see how do we now invite people to see what we have and what we can do. And this visit really is a great opportunity for that purpose.
The Kano Research Center will offer laboratory support for clinical trials and research opportunities, focusing on diseases like cancer and tuberculosis. This collaboration has the potential to drive progress in Nigeria's healthcare sector. The World Health Organization, WHO, has formally adopted the world's first global pandemic agreement, following more than 3 years of negotiation, prompted by the devastating impact of the COVID-19 pandemic. The landmark decision reached by consensus during the 78th World Health Assembly in Geneva represents a major milestone in national public health cooperation. The newly adopted pandemic agreement outlines core principles for pandemic prevention, preparedness, and response, with emphasis on equity in access to vaccines, diagnostics, and treatment. Crucially, the agreement also affirms national sovereignty, stipulating that WHO cannot impose travel restrictions, vaccine mandates, or lockdowns. A central feature of the agreement is the planned establishment of a pathogen access and benefit sharing system designed to ensure rapid and equitable sharing of pathogen samples and related benefits, including vaccines and medical tools, especially for low and middle income countries. The Federal Ministry of Health and Social Welfare has reaffirmed its dedication to improving eye health outcomes in Nigeria through strengthening leadership, robust partnership, and inclusive collaboration across all sectors in the country. This was the central message of the keynote address delivered by Dr. Paul Ntadom, Director of Public Health Department, Federal Ministry of Health and Social Welfare, at the 4th National Eye Health Coordination Meeting held on Tuesday in Abuja. In his address titled Strengthening Leadership, Strategic Collaboration and Partnership, and Progress Towards Improved Eye Health Outcomes in Nigeria, he highlighted the foundational role of visionary leadership in driving equitable access to eye care across Nigeria. Dr. Joshua Ibinu, speaking on behalf of the country director of Sight Savers, said the organization has partnered with Nigeria for over 7 decades, starting with efforts to eliminate river blindness and expanding into broader eye care initiative across several states. Lupus disproportionately affects women, especially of African descent, with symptoms ranging from joint pain to organ failure. Health experts say the disease is underdiagnosed in Nigeria, partly because symptoms mimic other illnesses and data on its prevalence is almost non-existent. For this warrior, the struggle with lupus is overwhelming, from diagnosis delay to high cost of treatment. From this Abuja gathering, one message is clear. Lupus may be invisible, but those who live with it are conscious of the reason. They want government support. They want to courageously deal with the disease and live healthier lives. Approximately 38% of menstruating women in Nigeria do not use sanitary pads due to lack of access to sanitary products. This is a significant issue that impacts their education, health, and overall well-being. This is why the iPad You Girl Child Support Initiative is calling on governments and parents to be involved in the menstrual hygiene management of girl child in Nigeria.
This is more like a call to action. What we are advocating for is that no girl child should be left behind. Whoever that is menstruating should not be held back because of stigma, because of discrimination, because they cannot afford sanitary pad. And most of them, when they are having their period, they don't go to school. They're always inside the house. Some of them miss exams, so we don't want that to happen. So we are here to encourage them and to also talk to them about personal hygiene, how to stay healthy before, during, and after their period, and also how to live a healthy lifestyle.
Some of the people said there was a need for provision of free sanitary materials across government institutions.
Some of them, don't be surprised, they've never used this type of pad before. And what you have done now, they will in turn go back to the society and give it back to the society. So you have not only educated those people that are here, but the society at large. And then we will spend less money in the hospital for all these vaginal problems, giving birth, cancer, and so on. So it's a welcome development.
Some of them, when they see their period in the school, they want to go. Some will even want to scale the fence to go home. Some will want to use that opportunity to say, let me just leave the school and go home and rest. And because we have it available, some in my department, we encourage them and they stay back. You see them coming to say, I just saw my period now. And they will give to them. They will go to the toilet and clean themselves. Government or non-government organizations, if they can be doing this regularly, it will go a long way to keep our girls in school and then for them to remain focused.
Some of the students appreciated the iPad You Girl Child Support Initiative. They said the awareness will go a long way in helping them adopt proper menstrual hygiene methods.
Today they educate us and also help us to understand why we need to communicate with our parents and also the importance to communicate with our dad.
Some people are not privileged to have this. Most people are using tissues, most people are using newspaper, most people are using towel and they are not hygienic. So please, we plead on behalf of the whole students or the whole children that they should make this free for people.
The theme for the World Menstrual Hygiene Day 2025 is Together for a Period-Friendly World, and it is urging collective action to ensure that menstruation does not limit access to education, healthcare, or opportunities.
That's our package for today. Thank you so much for being a part. I'm Ogom. Easy Dimbo. Stay safe.